Everyone, once again this week to ABL TV. Health matters. What health is worth and worth is health. ABL television is your #1 TV station that always brings you news, sports, the word of God, health and other vital information to your doorsteps 24/7 on Freeview IPTV, where you can get it on ABL TV television and all the other social handlers. I'm your host, Sakyibea. So today, what are we going to talk about on Health Matters on ABL TV? We are going to talk about menopause. This week is menopause week. Yes, this week is menopause week. So if you don't know, I want you to call your mothers, your sisters, your aunties, your partners to come and listen to this discussion we are going to have today. Because when you, and even you, as the man, the brother, the uncle, the partner, the husband, you also need to come and listen to this, so that when any of your relatives in going through this transition, you understand them and you will also be able to help them go through this transition. And also, it's this awareness day. So on Tuesday, the 18th of October, the World Health Organization set aside the day for us to recognize this transition, which is menopause, to raise an awareness on menopause, because there are some stigmas attached to menopause, whereby women who are going through this transition are not comfortable to come out openly to talk about it in order to get help, and they sit at their homes or wherever they are silent, and they go through a lot. So please get your pen and pencils, your papers, and jot down some of the things that I'm going to talk about. And as I said, when you know about this, you'll be in the best position or in a good position to support your loved ones. So, and also to let you know, menopause is not a gender issue, it's an organizational issue. Because when a woman or a woman is going through this transition, directly or indirectly, it can affect the organization, her colleagues at work, her family and friends. So we all need to be aware of this transitional stage, which is called menopause. So what is menopause? Before I explain what menopause is, there was a research that was done by the Chartered Institute of Personal and Development. And this research, the report came out saying that 3 out of 5 women between the ages of 45 and 55 said that they had symptoms of menopause. And when they had these symptoms, it had a negative impact on them. And nearly 2/3 of these women that they surveyed said that they were less able to concentrate. Then the same women, 30% of the women they surveyed said when they had these symptoms, they went off sick from work. But just a small amount of these women who went off sick from their work had the confidence or were able to talk to their line manager about the reason why they went off sick. So you can see why it's important for us to talk about menopause, because people are out there who are suffering in silence. They can't, even when they go off sick, they need to make up other things to say, oh, I'm off sick because of this or that. They can't come out to say it's because of menopause, because of the stigma attached to this transitional stage. So that's why it's very important for us as a society, as a community, and as friends and families to know about this transitional stage and not to judge people when they talk about it. So what is menopause? When we say menopause, what is menopause? Menopause is when when our period or a woman's period stopped because of the low level of hormones. So we have hormones, and when these hormones are lowered, when they are of a low side, the woman or the woman who is through this transitional period stop having her period. And so if we are saying they stop having their period, who are these women who are affected? So women between the ages of 45 and 55, sometimes it can happen naturally, or if even say as I'm saying is 45 and 55, it might be lesser than, sometimes some people start having before 45. But then in research have shown that women between the ages of 45 and 55 are more likely to be affected or to be going through this transitional event or this menopause. People whose ovaries or their uterus have been removed can also have menopause. Women or people who are going through cancer treatment, such as chemotherapy, are also likely to go through menopause. Then there are other times it's unknown. We don't know why it happens. And other times too, it's through genetic reasons. So if maybe your mom, when the time your mom or your sister started their menopause, it's likely that you will also experience the same transition at that age. So at least it will prepare your mind. When you get to know that, it will prepare your mind, and you will know when yours will also start, if you are going to have all those symptoms. We have two types of menopause. We have the perimenopause and also the menopause. Anything to say pre or peri, it means that it's when we say perimenopause, I said the menopause is between the ages, women ages between 45 and 55. So the perimenopause is and menopause is when your period stops due to low level of hormones. So perimenopause is when you start having symptoms a month or a year before your period starts. That's perimenopause. So when you start having symptoms, which I will discuss later on in the program, when you start having all those symptoms before a month or a year before your period stop, is what we call the perimenopause. Then menopause, as I've explained earlier on, is when your period stops due to your period stopped for 12 months. So the whole of 12 months you don't have your periods, then that is when your menopause has started. So perimenopause is when you start having symptoms month or a year before your period stops, and menopause is when your period stops 12 months. Within 12 months, if you've not had your period for a whole 12 months, that is a year, then you have to know that you started your menopause transition. So what are some of the symptoms? How will you know you started your menopause? Apart from your period, not having period for a whole 12 months or for a year, what are some of the symptoms? We can divide the symptoms into two, which will say the mental health symptoms and the physical health symptoms. So the mental health symptoms of menopause is when women says when you start having low mood, changes in mood swings. 1 minute sometimes you are happy or excited, another minute the same thing that makes you happy, the same thing that excites you when you hear about it, when you hear that same thing, it irritates you. It's also a symptoms. So mood swings, low mood. Then we have anxiety. Some people suffer anxiety when they start this transition. some also suffer low self-esteem. Low self-esteem is also one of the mental health symptoms of menopause. Others also have concentration problems. So they might be there, they can't concentrate, or sometimes it's a kind of short memory loss. When you experience all that, that is some of the symptoms, that is the mental health symptoms. So as I was saying, when you have your loved one going through all this, they will need that support from you. That's why we all need to be aware of this transition period, that is the menopause. It's not only our mother that needs to know, we as a family, because they are our loved ones, we need to know. Because if you are with somebody who is going through all this anxiety, low mood, and all that, they are going through it. So you need to be around and know how to support them. Then we have the physical symptoms. The physical symptoms is when you have hot flashes. Some people say it's even cold, but I still feel warm. It's cold, but I am very hot. You have hotness around your neck, hotness around your face. You're feeling dizzy. Sometimes because it's too cold for you, you end up having feeling dizzy in your own room, even when there is there's fan around, you still don't feel that kind of coldness. You see people wearing sweaters and all that, but you will just be fanning yourself. So those are the physical symptoms: hot flashes, difficulty in sleeping. You feel restlessness, having night sweats, you are tired, and because you are not sleeping well, you are most of the time tired, especially during the day, because you've not had a good night's sleep. You end up feeling tired, things irritate you because of lack of sleep. Palpitation, when we say palpitation, your heartbeat beating hard that you can even hear yourself. As we are there, when nothing is wrong with you, you don't hear your heartbeat. If you put your hand in your chest, on your chest, you will feel the beat, but not to hear it. So if you start hearing your own heartbeat, that is palpitation, is also a sign. It can be, if you are in that age group, then you have to think about menopause. Headaches, migraines, some of you constantly keeps on having headaches, migraines, you take medication for, you have enough sleep, you've been not working hard, doing what is right, but still having headaches and migraine are some of the symptoms as well. Muscles aches, joint aches, change in body shapes, and weight gain. Some people, I'm on diets, I try not to eat at night, I eat all the right food, but I keep on gaining weight. And some people, they end up gaining weight around their belly, even though they try not to eat late, not to eat carbohydrate, they eat all their veg and all that, but still they feel, when you are in that period, some end up gaining weight. Changes in our skin color. You have some end up having dry skin, itchiness in their skin, and sometimes some also have reduced sex drive. They don't even want to think about it. It's also some of the physical symptoms of menopause. Recurrent urinary tract infection, which we call UTI. So if you are in the age bracket, the age bracket is between 45 to 55, and you are getting all these physical changes, physical symptoms and mental symptoms which I've mentioned, then you need to speak with your doctor, you need to speak with your GP, you need to speak with your nurse or pharmacist, or you can even get help from your local council, or go online and just find, and there are help out there for you. it might be because you started your menopause. You are in that menopause transition. So in knowing both the symptoms, what is menopause, the types of menopause, the symptoms of menopause, how long does it take? Sometimes some people, so how long, if we say we are going to go through all this, transitional changes and this happening to her, how long? So at least we can, prepare our hearts, prepare our minds, and know that this is what I'm going to, so at least I know it's just for this period. But just to let everyone know, there are some people who might not even experience the symptoms I've mentioned. Others can experience more than one or two of those symptoms. So it all depends on us. When I was mentioning, I say it is generic, it can be natural, so it all depends on the individual. Some can experience all the symptoms, some can experience less of those symptoms, some can experience only the physical or the mental, and others might not experience any of those symptoms at all. So let's just be mindful of that. So when your period starts, within a year you've not had your period, you start having hot flashes, you start not sleeping well, having UTI, low sex drive, having mood changes, anxiety and all that, then you need to think about menopause. And if you are in the age of 45 to 55, as I said, it can be, maybe it can start before 45 or can go over 45, but you need to think about menopause. And it's not a shame for you to talk about it. You can read about it. You can go to your GP where you get help from. So how long? As I said, it depends on the individual. It depends on your genetic. It depends on your family history. Some of these symptoms can take months and it will go away, but other people too, it can take more than months. It can be a year or more. So we need to know all this, then we'll prepare our mind for. So when menopause happens, because we don't know all this, when these symptoms, people are going through these changes or they are experiencing these symptoms, because we don't know how long it might take for each individual, we need to support them, because sometimes it does have a great impact in their relationship, with their friends, with their family, with their loved ones. So if we know or if we are aware of this, at least we'll be there to support them. So what are some of the lifestyle changes that we can do in order to reduce the symptoms, or to reduce us to support ourselves as if you are going through this transition? So some of the lifestyle changes will be eating well. I always say we should eat well. Eating well helps our body, helps our brain, helps us psychologically. So we need to eat our vegetables, we need to eat our fruits. Eating well. Exercising. You exercise as well. When you exercise, it helps with our mental well-being. It helps with you as an individual as well. We should also try and have enough sleep. Plenty of sleep. If you have the time, you try and sleep and have a routine. Maybe you say for you I know sometimes maybe because you have children, your work, the way your work pattern is, but let's try as much as possible, if we can, to have routine. Our sleep pattern, we should keep the same sleep pattern or sleep routine and have enough sleep. We need to eat calcium rich food such as yogurt, milk, which helps with our bones, because when I mentioned some of the symptoms were muscles pain and joint pain. We can do things like relaxing things such as yoga, meditation, And sometimes we can even try and walk around, be with people, do charity work. As you are there, you have people you can talk to, because psychologically it helps you. You can, if you are someone who is experiencing hot flashes when you are going to bed, that is not the time for you to go and have your hot chocolate, your hot tea, your hot coffee. Try and drink cold drinks before you go to bed. Wear light clothing. Don't go and wear sweaters and all that, because it will worsen your heat. You'll be too hot to be able to sleep and sleep well. Let's try as much as possible as well to have cold showers before we go to sleep. Take vitamin D supplements. If you are in a country or a continent that is blessed to have sunshine, that's good. But if you are not, you don't have that advantage having sunshine on a regular basis, try and take vitamin D as a supplement. And if you want to take any herbal supplements as well, please speak with your GP first before you take. Maybe you might have any underlying illness which needs to be assessed and advised. So get advice from your GP before you start taking any herbal supplements. We can, but there are some things too that you shouldn't do. Not to smoke or not to drink alcohol above the alcohol limits. So if you are someone who is suffering from excessive smoking or drinking of alcohol, there are help out there for people to for you to get in contact for them to help you. So these are some of the things that you can do to reduce or to help you through this transition period if you are having all those symptoms that I've mentioned. And with the mental health aspect of it, the mental health symptoms, you can speak with your GP who can refer you for counseling and for talking therapy if you are having anxiety, low mood, affecting you psychologically. Please speak with your GP who can refer. You can also self-refer to be able to get access to a psychologist who can offer you counseling. If you are not entitled to free counseling, there are some charities who can also offer you a low-cost counseling. So please don't sit there and suffer alone. If you remember when I was starting, I said menopause is when your hormone level reduces. So if you are somebody, you've tried all these practical things, these lifestyle changes, and you are still not seeing any improvement in your health, and you are still having all those symptoms that I've mentioned, there are some hormone medication. If you speak with your GP who can refer you for, and we call it the replacement therapy, the hormone replacement therapy, where it can be implants, they can prescribe you tablets, they can give you some comes in a spray or skin patches, but you cannot get it from the counter. You need to speak with your GP who will just assess you and then refer you to it. Then there are non-hormone therapies, which I've mentioned some of them by talking therapy. And sometimes if your symptoms is more of the mental health symptoms, your GP can prescribe antidepressants medication for you, and there are some blood pressure medication or epileptic medication that helps with the menopause symptoms. So all these things, you need to speak with your GP first, and once you speak with them, your GP will assess you, and then when your GP assess you, will then direct you to or give you a treatment that will be best for you. And yeah, as I said, there are help out there. So please don't suffer in silence. go to your GP, go to your pharmacy, go to your nurse. Even there are walk-in centers as well. If you go and you speak to them, they will direct you, or they will give you the help that you need. And we have, as I said, we have menopause specialists, which you can go online, go to your council, look on your council website, and you can self-refer. If you don't want to go to your GP, or you think it's difficult for you to get an appointment with your GP, you yourself can refer yourself to your GP. So, ladies and gentlemen, menopause is a natural event and a transition that women go through. So please, if you are a woman who is going through this transition, please, there are help out there for you. There are a lot of help out there for you. Don't sit at home and suffer in vain. It's not something that you should be ashamed of. Everyone will go through this transition. So far as you're a woman, you go through this transition. But how each and every one of us gets the symptoms or go through is what differs. So if you are there and you are going through all this, or if you're a man or a brother or a husband who you've noticed, you know of your mom or your loved one going through all this symptoms, please try and seek help, or help them seek help for themselves. And you shouldn't let it hold your life. You shouldn't let it put a hold on your life without living a life worth living. So please, as I always say, let's go out there and seek help. Seek help. Talk about it. The more you talk about your problem, the more you will get help from people. But then when you are talking about your problem, always make sure you talk to somebody that you trust. Someone that you know will be able to help you. So thank you all for listening, and see you next week on ABL Health Matters. Health is worth, and worth is health. Thank you.